I have my MAR, my provider orders, and then my drug card. Alright, Matt. Hi, I'm Maddie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Jenna Wolf, 9/11/04.
Perfect. Just checked your history. To perform hand hygiene and provide privacy. Do you have any allergies?
Sulfa and betadine.
Okay. I don't need gloves or PPE for this. Today I'm here just to give you your medications. I'm going to ask you a few questions and then go gather the stuff I need and the medications, and then I'll be back to give it to you.
Mm-hmm.
Are you feeling any pain today?
A little. I would say a 2.
A 2? Okay. And can you swallow medication by mouth?
Yep.
Okay, perfect. If you're in a comfortable position and you don't have any concerns, I'm going to go give you that. Get it all ready for you, okay?
Okay.
Thank you. All right. So I'm going to compare my provider orders in the MAR. First, I'm holding digoxin because the digoxin level is 2.1 and the toxic level is 2.4, so it's elevated. I'm holding Lasix because the digoxin level is elevated, and I'm holding warfarin because the INR level is 3.6 and that's elevated. So since Joseph Smith said he had a pain rating of 2, I'm going to give Percocet, so oxycodone and acetaminophen. I'm going to do 1 tablet by mouth for pain rating 1 to 4. That's 5 milligrams of oxycodone and 325 milligrams of acetaminophen. On the provider orders, I have the oxycodone, 5 milligrams, acetaminophen, 325 milligrams. This is 1 tablet by mouth every 4 hours, and that's pain rating 1 to 4, which Joe said his pain is a 2. So he's going to get 1 tablet. So the MAR and the provider order compare, good. I'm going to put the provider orders away. And I'm going to say the nursing considerations for Percocet: assess pain, CNS changes, bowel status, and monitor I&O ratio. And 1 lab value would be checking the digoxin level. I'm going to hold digoxin if it's above 2.0, which the digoxin level is 2.1, so I held that for today. Another one is I'm checking the digoxin level before I give Lasix, and I'm checking the INR level before I give warfarin. Both were elevated, so I'm holding Lasix and warfarin as well. Alright, I'm going to start my first med check. So I'm going to get Percocet out of the drawer right here. Alright, so I have Percocet for Joseph Smith. This is 5 milligrams of oxycodone and 325 milligrams of acetaminophen. This is 1 tablet by mouth every 4 hours, PRN for pain 1 to 4. Joseph Smith has not gotten it yet, so it's good to give it. The integrity of the package is good, and the expiration date is 03/2039, so it's good. I'm going to get my med cup and put it in. And then I'm going to start my second med check. So I'm going to take it out of the cup. And this is for Joseph Smith. We have oxycodone and acetaminophen, 5 milligrams of oxycodone and 325 milligrams of acetaminophen. This is 1 tablet by mouth every 4 hours, which he hasn't gotten it yet. PRN for pain, 1 to 4. And the integrity of the package is good, no breaks. Looks good, and the expiration date is 03/2039. And I don't need to split or cut this because the dosing is perfect, which is 5 milligrams of oxycodone and 325 milligrams of acetaminophen. So I'm going to put my medicine back in the cup, and I'm going to get my MAR and my drug card and go to the patient's bedside. Knock, knock. Hi, I'm Maddie. I'm your student nurse today. Can you tell me your name and date of birth?
Jenna Wolf, 9/11/04.
Perfect, your wristband matches. I'm going to perform hand hygiene and provide privacy. Do you have any allergies?
Sulfa and betadine.
Okay. I don't feel the need to wear gloves or PPE. I got your medication already. I just have to do a quick med check and talk to you a little bit about the medication, and then I can give you that, okay? Do you have any concerns before we begin?
No.
And are you comfortable?
Yep.
Okay, I'm gonna come over here and just do the last med check quick to make sure it's correct. Okay. Alright, so I have Percocet for Joseph Smith. This is 5 milligrams of oxycodone and 325 milligrams of acetaminophen. This is 1 tablet by mouth every 4 hours, PRN, which he has not gotten it yet. And this is pain rating 1 through 4. He said his pain was a 2, so we're going to give 1 tablet. Going to scan the medication, and I'm going to scan your wristband. Good. Right, I'm putting it back in the cup, and I'm going to teach you a little bit about it, and then I'll give you that. So for Percocet, the uses are for moderate to severe pain. Some side effects are drowsiness, dizziness, confusion, fatigue, and a more serious side effect would be respiratory depression. Can you teach me back what the use of Percocet is for?
Pain.
Alright, and can you give me 1 side effect?
Dizziness.
Okay, good. If you are okay with taking your medication, I'm going to grab it and then we'll get it down. So I'm going to give you that with some water. And just let me know when you have it down.
It's down.
Perfect. Alright. So I held the digoxin because the digoxin level was 2.1. I held Lasix because the digoxin level was elevated, and I held warfarin because the INR level was 3.6. I gave you your pain medication, which was Percocet, for the pain rating from 1 to 4. You said your pain was a 2. I would have double checked that the patient can swallow medication orally. I did it in the beginning, but I would do it again when I came for the 3rd med check. I'm going to write my MAR out quick and check that. So now I'm going to chart and document any concerns per agency policy. I'm going to come back and reassess you in 30 minutes. If adverse effects were showing, I will assess your vital signs. I will contact the prescriber and the pharmacy. I'm going to chart per agency policy, and I'm going to withhold any further doses. Let me think for a second. Alright, and if you don't have any concerns, if you're comfortable, I'm gonna get out of your hair and going to make sure you're safe. So your bed is low and locked, your side rails are secure, your call light is within reach, your table is near, and your room is risk-free of falls. Going to perform hand hygiene, and the 5 moments are before touching a patient, after touching a patient, when coming in contact with bodily fluids, when touching a patient's belongings, and before a procedure. If you're good, I'll let you go. Do you need anything?
Nope.
Okay. Before I end, I'm gonna make sure I have everything. All right.